Good afternoon and welcome to the Bureau of Justice Assistance webinar, Improving Justice and Mental Health Collaboration, Training and Technical Assistance to Grantees and the Field.
Hello and good afternoon. My name is Maria Fryer and I'm a policy advisor here at the Bureau of Justice Assistance, and I oversee the Justice and Mental Health portfolio, which includes many policy initiatives and the grant program known as the Justice and Mental Health Collaboration Program. Having the opportunity to do this work at the local, state, and federal levels for some time now has been a great experience. Training and technical assistance providers from previous years can attest that supporting justice and mental health collaboration grantees and the field in general really changes lives and whole communities in the way they view mental illness and the way they do business to tackle such a complex problem. So for an overview for today's presentation, we'll begin this webinar by telling you a little bit about what the intention of the program is. This webinar is intended to provide some important information as BJA seeks a training and technical assistance provider to support the Justice and Mental Health and the Justice and Mental Health state-based capacity building program. Advance to the next slide, please. Great, there we go. Both grantees and the field rely on expert training and technical assistance to plan, implement, and sustain cross-system collaborations required through justice and mental health. Next, our agenda. So for today's webinar, in the next hour or so, we will cover these items 1 through 10 and also hope to take some questions and answers. Some questions can be easily answered and some may require a little more discussion or follow-up, and we are happy to help with that. So if we don't get to your question today, or if you think it requires a little bit more time and thought, you can certainly write www.ncjrs.gov, and specifically that's the website for information, but you can send your questions to grants@ncjrs.gov, and they will send your question over to me and we'll provide you an additional response. Next slide. So eligibility is really important, and if you'll just bear with me, I'm going to go ahead and read through this, not to miss a beat. Eligible applicants are nonprofit organizations, including tribal organizations and for-profit or commercial and tribal organizations, faith-based and community organizations, and institutions of higher education, including tribal institutions of higher education. The applicant must be the entity that would have primary responsibility for carrying out the award, including administering the funding and managing the entire program. And really important is this third bullet. Competitive applications will include partnership with a police organization or association that has the capacity to consult and engage communities on issues of improved justice system and public health responses to people with mental illness or co-occurring mental illness and substance use. Next slide. So the purpose of training and technical assistance to grantees and the field. The Justice.
Good afternoon, everyone. We appear to be having a little bit of technical difficulty at the moment. If you can please bear with us, we will start again in a couple of minutes. Thank you.
We apologize for the technical issues, and we will be picking up again. I am sorry.
Okay, let's go ahead and look at this slide, purpose of training and technical assistance to grantees and the field. So the Justice and Mental Health Collaboration Program aims to improve comprehensive cross-system collaboration. It's a unique program that spans the entire criminal justice system, making system improvements for people with mental illness. Training and technical assistance is critical to the success of these collaborations between justice and behavioral health. Two complex systems with a common goal to improve response. Collaborations can be successful and with shared goals and policies and procedures through technical assistance. So next, we'll talk about the categories and the deliverables for training and technical assistance. Next slide. Category 1, Justice and Mental Health Collaboration, Program Training and Technical Assistance. Next slide, please. Next one, Category 1, Objective 1. Provide comprehensive, responsive, individualized training and technical assistance to Justice and Mental Health Collaboration Program grantees, Categories 1, 2, and 3, to meet their objectives, deliverables, and activities. So the deliverables are very broad expectations. They include work plans for grantees, and please note that BJA may require the selected provider to submit for review and approval of proposed training and technical assistance plans, protocols, or strategies in advance of dissemination and implementation with grantees. They also include planning with grantees in the field, coaching, problem solving, technical skills and evaluation, imparting expertise and being able to relate to a variety of communities and cultures across the country, data collection, having lots of expert friends and sharing them with grantees in the field, and facilitating good rapport with JMHCP communities. Next slide. Category 1, Objective 2. Providing training and technical assistance to JMHCP Category 1 collaborative county approaches to reducing the prevalence of individuals with serious mental illness in jails, grantees to increase and maintain jail capacity for violent offenders, and develop system-wide coordinated approaches to safely reduce the prevalence of low-risk individuals with mental illness and co-occurring mental illness and substance abuse in local jails. Next slide. So here we have the 4 key outcomes for Category 1 grantees. And before we talk about Category 1 deliverables, it's really important to take note that you'll hear a lot about baseline measures. And these 4 elements speak to the baseline measures for Category 1 grantees. These 4 key measures are foundational to the technical assistance deliverables for grantees in the field. They are important to measuring the impact of program activities on the service population and central to this category. Next slide. So for the deliverables, training and technical assistance should provide expert guidance to develop a plan to create peer-to-peer state and county learning sites through Category 1 grantee cohorts that can serve as model sites to include facilitated calls, webinars, and site visits. Training and technical assistance also involves assisting in the development of a plan to conduct timely screening and assessments for both programs and activities of mental illness and co-occurring mental illness and substance abuse, and for risk of recidivism. Provide agency guidance to establish baseline measures, and also using a document that was produced by our current training and technical assistance providers along with BJA and other colleagues, titled the 6 Questions document, which is a planning tool to assist grantees to conduct comprehensive process analysis and inventory of services to determine existing policies, practices, programs, and treatment. Training and technical assistance will help Category 1 grantees to prioritize policy, practice, and funding improvements and estimate the impact of new strategies, and also assist grantees in the establishment of a process for tracking the impact of the mentioned 4 key outcomes: the number of people with mental illness booked into jails, and number 2, their length of stay in jail, number 3, connections to treatment, and 4, recidivism rates. They will also assist grantees to design a data integration, data matching system between jails and the community service providers to better understand patterns of people considered high utilizers of multiple systems such as healthcare, housing, and the use of emergency medical services, or EMS, to improve and increase coordination, response, and community capacity. Next slide, please. Category 1, Objective 3, is to provide targeted training and technical assistance to assist JMHCP Category 2 strategic planning for police and mental health collaboration grantees to free up law enforcement time to focus on responding to violent crime and to improve officer and citizen safety during calls for service involving people with mental illness and co-occurring mental illness and substance abuse. This category is focused on the early intercept or front end of the criminal justice system. It is focused on police mental health collaborations and improved or enhanced responses to people with mental illness through increased collaborations between law enforcement and their behavioral health system partners. Next slide. So related to Category 2 and the early intercept of the criminal justice system are the 4 outcomes for this objective. And they are connections to resources, reduce repeat encounters with law enforcement, reduce the number of mental illness and intellectual and developmental disability-related arrests when diversion might be appropriate, and reduce use of force and injury when behavior can be diffused by other means. Next slide. So here are the deliverables. Develop a specialized training and technical assistance strategy for Category 2 law enforcement grantees using the Police Mental Health Collaboration Framework document for police leadership and their mental health system delivery partners. Guide grantees in establishing an interagency work group that includes law enforcement, behavioral health, and all other major stakeholders, including 911 and dispatch, hospital, courts, corrections, and housing. Assist the project coordinator to review data on performance and adherence to policies and procedures, day-to-day operations according to the PMHC mission, and ways to coordinate outreach and engagement with other partners. Review and provide feedback on and help revise as needed existing protocols to respond to people who have mental illness and co-occurring mental illness and substance abuse, including interagency agreements. Screening, guidance for mental health calls for service, and information sharing. Also, review and provide feedback on existing officer call taker and mental health provider training to improve encounters with people with mental illness. Assess existing behavioral care resources such as crisis lines, mobile outreach, crisis facilities, outpatient treatment, and other types of community responses. Help grantees identify gaps in services and prioritize behavioral health resources for police mental health collaboration, or PMHC. Assess and provide strategies to track mental health related calls for service and dispositions of those calls, and assist in developing additional capacity to analyze and track these calls for service. And finally, training and technical assistance is expected to assist with the design of data integration and data matching systems between law enforcement and community service providers to better understand patterns of people considered high utilizers of multiple services, such as healthcare, housing, and the use of EMS to improve and increase coordination, response, and community capacity. Next slide. So Category 1, Objective 4, to provide training and technical assistance to assist JMHCP Category 3 implementation and expansion grantees to increase public safety and reduce recidivism among high-risk people with mental illness and co-occurring mental illness and substance use. Training and technical assistance with a variety of expertise for this category is needed. There is a variety of programs. This is our widest category of programs that expand upon any program along the criminal justice continuum. It's a very broad category with a lot of expertise needed to plan and implement and expand and enhance current and existing programs. Next Next slide. So here we see the deliverables are to expand cross-system training for criminal justice, mental health, and substance use treatment personnel, and also to appropriately inform decision-making and prioritize limited resources. Also, significant mental health needs who are at high risk of reoffending. The supervision of people with significant mental health needs. And also, to increase the use of case management and service coordination, including evidence-based treatment models that are tailored to meet the assessed needs of the target population. Also, case management and service coordination housed inside police agencies, evidence-based or promising mental health and treatment practices. And also, to make eligibility determinations and ensure direct connections to treatment services in the community. Next slide. Category 2, Justice and Mental Health State-Based Capacity Building Program. This category is to develop and provide information and training and technical assistance to the field to support cross-organizational coordination. This category has historically been in place to support the needs of the field more generally, especially for unfunded jurisdictions in need of training and technical assistance to build collaborative responses. Next slide. The training and technical assistance provider must serve as a thought leader and information clearinghouse for relevant research and best practices. They must also create and disseminate knowledge diffusion products, coordinate strategies with other TTA providers and federal partners in order to minimize duplication. They should disseminate best practice and lessons learned by facilitating a presence at national, state, local, tribal, and other conferences and events, and prioritize and respond to the field-initiated requests, also engage in cross-organizational coordination, and be both aware of and in touch with other key overlapping initiatives and other BJA training and technical assistance providers in various jurisdictions. They should assist in coordinating existing federal partnerships and strategies related to justice and mental health collaboration. Next slide. Category 2, Objective 2, to increase coordination, tools, and resources that build state and local capacity to improve system responses to and outcomes for people with mental illnesses in the justice system. This category is really about broadly engaging national partners, state and local partners to problem solve through policy and practice. It's also about the development and use and implementation of BJA tools and products to improve service delivery, and building upon experience, lessons learned to expand upon best practice and system-wide comprehensive response. Next slide. So the deliverables involve stakeholder engagement and coordinated system responses, also assisting states in policy development and implementation that facilitates and improves local and county justice mental health initiatives. Also, TTA providers are expected to provide basic triage assessment and guidance to provide a plan and process for assistance, and also assist law enforcement agencies and community partners to convene and review policies and procedures regarding community responses to homelessness. Also, strengthen law enforcement mental health partnerships using the PMHC, or Police Mental Health Collaboration Framework, and policy guide where appropriate. Assist jurisdictions with the framework's 4 key measure outcomes, which we discussed earlier, and provide special focus on responding to homelessness and increasing connections to community-based services. They're expected to refine and grow self-help tools and guide local efforts to reduce the number and prevalence of people with mental illness in jails. Also, provide guidance through written products, training and technical assistance regarding a collaborative coordinator's response and role and activities in assisting communities. Next, more on BJA resources. So we talked a lot about using existing resources, and we thought it would be important for you to have these, a brief description and links regarding these existing resources and tools. The first is the Justice and Mental Health Collaboration Program itself, which just went live yesterday, and the link is below. The National Center on Criminal Justice and Disability has been a partner with BJA under a cooperative agreement for quite some time, dating back to 2012, and is one of the only vendors and partners that provide technical assistance and guidance in responding to people with intellectual and developmental disability. The Police Mental Health Collaboration Toolkit, next slide, oh there it is, great, was launched in 2016 to provide a centralized learning site detailing how to plan, implement, manage, sustain, and evaluate police mental health-based responses to people with mental illness. In 2019, this year, is undergoing additional content updates to include collaboration from a behavioral health perspective and guidance on people with IDD and people with lived experience and mental illness. The Stepping Up initiative is a partnership aimed at reducing the number of people with mental illness in jails. Over 483 counties to date have passed resolutions to develop action plans to achieve county system changes. And I'm sure that number has gone up because it goes up every day, and it's great to see. So please visit the website. Additional existing BJA resources are, and we've mentioned it several times throughout this presentation, so you're probably wondering how to access it, is the Police Mental Health Collaboration Framework document, which is intended for law enforcement leadership and management to increase and enhance their comprehensive system responses using the 4 key outcome measures that have been established as the most important indicators of a comprehensive response. Through an extensive literature review and focus group inclusive of the nation's top researchers and law enforcement mental health response and additional discussion, the following outcomes are the basic indicators, and you can see those on your screen. The next resource is the Effective Community Responses to Mental Health Crisis, which is a national curriculum for law enforcement based on best practices from CIT programs nationwide. It is currently under additional pilots. BJA has partnered with other organizations to pilot this curriculum 2 times in the following jurisdictions: St. Tammany Parish, Louisiana; Honolulu, Hawaii; Alamogordo, Texas; and Huntsville, Alabama. And we hope to have additional feedback and future iterations of this national curriculum. Next slide. So overall, training and technical assistance requirements. Again, this is to recap some expectations for TA providers. You must coordinate with NTAC. Performance is critical, and we always expect coordination with other training and technical assistance providers to leverage what is currently existing, to not duplicate efforts, but to expand and grow. And anything we do expand upon, we do that together. Cooperative agreements are a partnership with BJA, and we expect significant input as a partnership. Data and best practices are always key. So next, we'll talk briefly about what an application should include. So an application should include an SF-424, or Application for Federal Assistance, a project abstract, program narrative, budget and associated documentation, indirect cost rate agreement, if applicable, financial management and internal control questionnaire, disclosure of lobbying activities, and additional requirements for this solicitation are project timeline and task plan, position descriptions and resumes, letters of support and memorandum of understanding, work product examples, applicant disclosure of pending applications, and research and evaluation independence and integrity. Next, how to apply. Applicants must register in and submit applications through grants.gov. It is really important to understand that the SAM process, or applying for a SAM registration, has somewhat changed in the last year. Any applicant for an OJP award creating a new entity registration or updating or renewing a registration in SAM.gov must submit an original, signed, notarized letter appointing the authorized entity administrator within 30 days of the registration activation. Notarized letters must be submitted via U.S. Postal Service mail. So my suggestion here is really to start early. And since the solicitation is open for 60 days, really the time is now. So I would just urge you on this, these federal registrations, if you're going to apply, to really look into this very soon. Next, the review criteria. So description of the issue is weighted at 15%, and this is the review of the application, the different sections and the weights that they carry. The project design and implementation is weighted at 40%, so that's weighted quite heavily, and a lot of time should be spent there. Capabilities and competencies, 30%. Plan for collecting the data is at 5%, and budget narrative is at 10%, and you can find that on page 32 of the solicitation. So some basics about the award. This award is a cooperative agreement. As I mentioned, it's a little bit different than a grant. BJA and OJP do have significant involvement in all the activities, all the deliverables we talked about today. BJA typically reviews all products and participates in the development of products and activities that are delivered to the field. So it's important to note that a cooperative agreement is a little bit different than a grant. Next slide. Application assistance and support is provided through the National Criminal Justice Reference Service Response Center. And below you can see some contact information, and as I mentioned, you may have additional questions that do require a lengthy response. So we're happy to help you with that. It has to be questions that are specific to what's in the solicitation. We can't really comment on how you're designing your project or what you'd like to do, but I would just encourage you to submit your questions regardless, and we can always talk through what we can provide answers on and what we cannot. So it doesn't hurt to ask. Next slide. And for application assistance, again, grants.gov. Okay, so we encourage you to stay connected and follow us on social media, and the contacts are listed below. Next slide. Okay, I'll hand it over.
So, looking at the slide right now, BJA did a series of 4 webinars earlier this year, and you can access those webinars, the recording, transcript, and the PowerPoint presentations listed at the URL listed on the slide. Each of these webinars covered aspects of the application process and would provide you some additional guidance as you move forward in this application as well as other applications with BJA. There are a list of resources on this following slide, including some important things such as the DOJ Financial Guide. This will help you understand developing your budget and what information is needed and what to consider. Other resources, the OJP Funding Resource Center and the Financial Management Online Tool could also be of assistance to you as well. NIJ's crimesolutions.gov is a good resource to find out what programs are out there and if they're rated as effective, promising, or not effective, and that can give you some guidance in developing your proposal. At this time, then, we can open it up to questions.
Okay, our first question is, can you confirm the award amount for Category 1 and Category 2?
Yes. So confirming the award up to, for Category 1 is up to $2,480,000, and for Category 2 is $1,860,000.
Another question came in. There are grantees mentioned multiple times under Category 2 Capacity Building Program. Is it accurate that information will be provided to grantees under this category?
The Category 2 generally is for the field. However, grantees can certainly benefit from anything that's developed under Category 2, and they quite often take advantage of policy and products that are developed. They are for the field in general. So whether or not a grantee, whether or not a community has received funding in the past through JMHCP or are currently receiving funding through JMHCP, they can still benefit from any activities under Category 2. One example of an activity that's currently underway, an initiative, is the Stepping Up initiative. That is an initiative that's underway, and it is funded through this funding stream, and it does benefit the field at large, but also many of our grantees do take advantage of the information that's on the website and a lot of the tools and products that are developed through this funding stream.
Next question is, in this webinar, law enforcement responses to people with developmental disabilities was mentioned, but it's not outlined in the solicitation. Can you confirm that the TTA provider under Category 1 will be providing TA on IDD?
So this field is growing. We do have a solicitation that is very specific to responding to police responses to people with IDD. And that solicitation, we're going to talk about that later today. That's another webinar. However, this solicitation is more specific to providing training and technical assistance to our JMHCP grantees and to the field regarding people with mental illness. However, when you're providing training and technical assistance to our Category 2 and Category 3, and even at times our Category 1, a lot of times law enforcement are responding, and they also need training and technical assistance to understand what they might be encountering. And we also encourage through this solicitation that the training and technical assistance provider coordinate with other training and technical assistance providers that may have this expertise in responding to people with IDD. We definitely want to help meet law enforcement where they are and where their training needs are, either by having staff members that are somewhat versed in responding to people with IDD, can answer questions and understand and make appropriate referrals if further expertise is needed. So we do need to have some knowledge, but it is not specifically mentioned, and it is not a focus area of this solicitation, but we do expect that the training and technical assistance provider will have some baseline knowledge and understanding and knowledge on how to make referrals and who to make referrals to.
All right, the next question is, what level of support is expected on data match or data sharing advisement?
So this is a really important area I think for the field, for our grantees certainly, in terms of what we're expecting from them is data-driven, is the collection of data in order to inform practice and to improve upon practice, and really to understand the prevalence of the target population and how to appropriately apply resources and then use data to inform and enhance practice. So we need training and technical assistance providers to be able to assist grantees in the field in the collection of baseline data, especially with our Category 1. We have 4 key outcome measures. We also have key outcome measures for Category 2 for law enforcement in order for them to measure the impact of their responses. And so, yes, proficiency is really, really needed. I would say there's a heavy focus and a heavy emphasis on data collection.
Okay. Here's another question that's come in. Under Category 1, Objective 2, it indicates low-risk individuals with MI, CMISA. Is this TA only to focus on low-risk people?
That's a good question. I would like to maybe go back and see what you're referring to. Which slide? Can you, we might have to follow up on that, because typically high utilizers are not low risk. So I'm not sure if I'm understanding the question in appropriate context, because high utilizers of multiple emergency systems and community services are really the people that are considered potentially having serious mental illness, and really that's where our focus is. So I'm not sure if I'm understanding you correctly, and I want to make sure that I answer you. So maybe some follow-up is required there. I would follow up with your question in an email to NCJRS so that I can provide you a written response.
Looking for our next question. Here's some questions that are coming in. Does there need to be funds budgeted for the TTA provider to travel law enforcement and mental health partners to the law enforcement mental health learning sites?
That, I would say yes. There is an emphasis to provide guidance and coordinate peer-to-peer learning with the 10 law enforcement mental health learning sites. I would say budgeting for that would be important. We also are in the JMHCP solicitation, just to kind of crosswalk that program with what we're asking TTA providers to do. We're asking TTA providers to coordinate those visits between grantees in the field and our 10 law enforcement mental health learning sites. But we're also asking our JMHCP applicants to actually put funding in their budget as well to actually make those visits. So hopefully, there'll be funds in the budget of the site-based as well to make those peer-to-peer visits.
Okay. Here's the next question is, can you further explain what field guidance is under Category 2?
So field guidance is just kind of a general term, sort of a catch-all to describe that you can actually provide training and technical assistance to a jurisdiction or a community or an agency or an entity that is not funded with JMHCP and doesn't have any connection with federal funding whatsoever. We know that there's a large number of communities that have never applied or maybe don't have the capacity to apply, but they're still dealing with the same issues that any other community is dealing with, and they require or need training and technical assistance. So it's kind of a catch-all term to describe the field in general.
Okay, so we want to just draw your attention to staying connected via social media and BJA's website. If there are any more questions coming in, please go ahead and make sure you put your question into the Q&A section and not the chat section. We want to make sure that we get to it. In the meantime, please take a look at the slide that tells you about staying connected with social media through Facebook, Twitter, and the RSS feed that BJA has available to you. Also, remember BJA's website at www.bja.gov. And we'll wait a couple of minutes to see if we have another question or two coming in.
Well, we'd like to thank you for participating in the webinar today. It looks like we are through with the question and answer portion, and we have some general information up on the screen. I encourage you to read the solicitation. Cover to cover is always best practice. There's just so much information in there. There's also a checklist in the back of the solicitation, which I think is very helpful. It helps me from time to time remember all that's in the solicitation. It's very comprehensive, but I am very encouraged by the number of folks on the call today, and I have thoroughly enjoyed working with training and technical assistance providers currently and in the past. And so I just wish you the best of luck on your application, and I look forward to reading them. So have a wonderful afternoon. Bye-bye.